us wait to see if the Prime Minister's latest measures to tackle rising coronavirus cases will plunge them into lockdown later today.
Well, Boris Johnson is expected to make a statement in the House of Commons that could see pubs and restaurants close again, along with other measures like a ban on overnight stays.
Well, whilst we wait for that announcement, we're going to talk to our This Morning family based in the north. We'll chat to Dr Chris in just a moment, but we're going to start with Emma Kenny. Good morning to you, Emma. So we're talking about what this lockdown may look like, and there's 3 tiers here. Tier 1 would be following the rule of 6, social distancing, 10 p.m. curfew for venues. Tier 2, a ban on households mixing indoors, including in homes and pubs. And Tier 3, avoiding all forms of social contact with anyone outside your household, likely to include pub and restaurant closures. And Emma, you feel really strongly about this, don't you? That you think that this is a nonsense, really, and that this goes against what the World Health Organization has said.
That's exactly it. So I think at the very beginning, I want to make it clear, I didn't know anything about it at the beginning, and Boris Johnson did what he did, and we all had to wait because we didn't know the science, we didn't know the data, but we do now. So we know, for example, that the reason that there are lots of cases rising in certain areas correlate with university students who are mostly asymptomatic, and actually they aren't going to be causing problems because they'll get that dealt with in that situation and carry on with each other and stay in their 14-day quarantine and so on and so forth. But actually what's really problematic now is what we're seeing is this kind of inflation of cases, and people like Professor Levitt at Stanford saying lockdowns don't work, who's saying lockdowns don't work, the government themselves saying the deaths that are going to come from all of the other issues associated with lockdown are going to be bigger than the deaths that we've had from coronavirus deaths. So it's not actually logical, linear, and it doesn't even make a difference, because if we look at the data, and I've been absolutely obsessed with the government data, because I know that you're not allowed opinion these days unless you do that and find that and can evidence it. But one of the things that's incredibly clear to me is the areas that have been locked down. I've been locked down for a very long time. My mother's not allowed in my house. It's risen in our areas exponentially because actually people get COVID in family networks in the houses and they aren't dying of it in the way that they were before. And it's really, really tragic now for mental health. I can't tell you the amount of anecdotal evidence I'm getting regarding suicide on mental health issues through the roof. So I'm not just against it. The national organisations and international organisations are against it as well. So what is our government doing?
So do you believe that the cure is worse than the virus?
Even if I stand to the side of it, because I think you'll see on social media, I'll get quite a lot of negativity about the fact that I have an opinion. So if I stand to the side of my opinion and instead look at all the studies that have been done, and now there are vast amounts of studies on these kind of issues and impact of lockdown, they are quantifying my opinion. So I am not necessarily forming that opinion myself. I'm listening to people who have done the research and all of those around that saying this does not work and actually it's going to be more dangerous by far. And if you look at the capacity of the NHS at the peak, it was awful for the NHS. I can't imagine how traumatising it was for doctors and nurses on ICU, but we still have to look at the actual percentages that the hospitals were dealing with. And then the empty beds by June, nearly 50% of beds across the NHS in the day were empty, 35% overnights were empty. So we're seeing that we've got a problem with all those other cases of illnesses that aren't getting heard. And the problem we've got is that children are going to be affected by this, probably drastically and devastatingly. And if you could show the evidence and it was linear and it made sense, we'd all be for it. It doesn't. It's actually chaotic, destructive, and mental health-wise, I am waiting for more of this. I've seen the tsunami anyway.
Why are children going to be affected to such a catastrophic level?
So I've been working with quite a lot of people in mental health recently to just observe the kind of impact just on services, but also I think on diagnoses. There's a lot of doctors now starting to have the bravery to come out and kind of talk about the fact that appointments have been missed. Also, we just know that on an abuse level and on a mental health level, the catastrophic impact of things like poverty. So it won't be necessarily right now. In 12 months, we'll see things like the suicide rates, which I would be unbelievably surprised if they weren't up quite considerably. But in 5 years, we're going to see the impact of things like domestic abuse, and we're going to see the impact of poverty rising and the impact on nutrition, which then causes disease. And poverty and disease are the biggest linked, and social isolation. That's the other irony, Phil and Holly. We've always in the NHS talked about social isolation being one of the biggest indicators of an early death. And yet we are socially isolating people. capsizing the economy. Unemployment's going to go through the roof. That's going to cause mental health issues. And my fear is not only is the cure worse than the actual disease itself, it's that we have got 10, 15 years exponentially of change that's going to be affecting people both on an economic and mental health level, and we've got to speak out about it.
Right. Emma, thank you. We'll come back to you in just a moment. Dr. Chris is on the line now as well. Morning, Dr. Chris. Nice to speak to you this morning. And actually, you say you may think that your opinion is unpopular, but you think what the government is doing is right, and that a northern lockdown, is what is needed.
I think Emma is such a good talker. She should be Prime Minister. However, the situation is that, and what I'm going to say does not bring me any sort of pleasure whatsoever. I mean, I'm a doctor. I worked in medicine for 40, 50 years. And although Emma has said that, she said some contradictory things. So the situation is cases are surging. They've been surging in countries all around the world. Now, why are they surging now? Because initially, when the infection exploded, for example, in Wuhan, China, and in New York, they closed the cities down, complete lockdown, and the complete lockdown worked. Totally unpopular, but they certainly New Yorkers just took the message on board and got stuck into, total lockdown.
But Chris,
now,
Chris, the thing is, though, I mean, and I appreciate that fully. Yes, let's take New York, total lockdown, and the numbers went down. But then it came back. And it's the same here. We've gone through these various individual lockdowns. It's reduced, and then when we are given a little bit of freedom, it comes back. All we're doing is kicking the can down the road. It will keep coming back until there's an effective vaccine. It will keep coming back, and you can't keep locking people down because, as Emma just used the phrase, it will capsize the economy.
Well, there are degrees of lockdown, but why did the infection come back? Why did the cases rise? Because people became more relaxed. They felt that we were on top of this because cases were coming down, hospital admissions down, deaths down. More relaxed when they're outside. Social distancing went out of the window. Mask wearing wasn't as popular as it was. You go into bars or restaurants, people were next to each other. Meetings were, political meetings, especially in America, but another country, when people meet, when they congregate, they're close to one another, and you don't know who's got the disease or not. You feel healthy, you're well, and you have got the disease because 60%, 70% of patients with this infectious disease, highly infectious disease, have actually got no symptoms, and so they're spreading the virus through the air. And it hangs in the...
Why is there such a massive north-south divide here? In Nottingham, 830 cases per 100,000. Knowsley, 669.5 cases per 100,000. Liverpool, 598.5 per 100,000 people. Then you come down south, Richmond, these are the worst boroughs of London. Richmond, 130.8 per 100,000. Hackney and City of London, 120 per 100,000. Ealing, 115.3 per 100,000. Why is there such a big difference between the north and the south?
I mean, I don't know the true answer to that, but, there could be lifestyle issues, habits such as smoking and drinking and weight gain, poverty, poor incomes, could have a part to play. There are many factors there, and I don't know the answer, but it's happening, and we have to do something. There has to be some form of lockdown. It could be mild.
Dr. Chris, can I ask you, because some people are saying, well, if this is taking its impact on people that are older, or if people are more vulnerable and they have to shield, rather than doing a sort of geographical lockdown, sort of shield those people that it is going to impact the most and let those that it doesn't impact at all just get about their daily lives so that the economy doesn't capsize?
Yeah, there's an argument for that. I mean, I'm open to anyone's viewpoints, but we have to do something. We can't just let this run rife, and anticipate herd immunity, which will kill thousands upon thousands. What I'm frightened of now is, as we approach winter, there's going to be an explosion of this coronavirus in this country, and we've got to stop the cases rising between now and the colder months where we're all indoors, we're closer to one another, and it's an ideal environment for this virus to spread.
All right, Emma, so Dr. Chris says there's going to be an explosion this winter. You've got to do something. We can't just let it run riot. As he said, it will kill thousands of people. So what do we do?
I think we've been talking about this explosion since it stopped exploding, and would expect, I've spoken to quite a lot of doctors because, again, I want to get informed, and they're saying that, of course, there'll be a rise in winter because you'd expect that, and they're also starting to combine the influenza with the COVID. So you'll have a higher reach there of people who are maybe going into hospital. What I think the problem that we've got is that Dr. Chris has just said about us needing to lock down further, but who? The organisation, the World Health Organization, have said that's incorrect. When did our government decide to be so risk averse to even the advice of the people that initially they said they were taking the advice over? And also, yes, in the north and in university towns, we're testing lots of students. If there's an outbreak at halls, you're going to get lots of students asymptomatic, not very unwell at all. And the big problem you've got there is, once upon a time, if I'd been asymptomatic, I wouldn't have known. Neither would you. Same with any kind of illness, because if you're not showing symptoms, you wouldn't be aware. The minute you start testing for symptoms, you're going to find that those symptoms exist in certain pockets. And then you have a bigger problem, because you can say, well, OK, it's awful that people die, but when you look at the age demographic, you've got to acknowledge there is a significant age demographic difference. That doesn't mean that those lives aren't worthwhile. That doesn't mean that we haven't got to be aware of how to protect them. But then you have to add to that, and this is a really important bit, Dr. Chris, and this is something that, as somebody who's worked with families who've been affected by dementia, I know that the average amount of time of somebody in a care home residentially is 9 months. I know that a lot of those cases have dementia, and that means that the chance of them dying because they're not getting to see their family is exponentially higher. The Dementia Society are talking about that. Alzheimer's Society are talking about that. So we're actually denying people who need life, the life that they're given from the people who love them. We're denying children freedom, and we're giving the economy a shift in such a direction that our children and grandchildren, and there's one thing that kind of gets me sometimes, because I am outspoken and it's not a comfortable place to be, but I am devoted to mental health. I'm devoted to it. And when people say to me, you don't understand, the people above you gave their lives in the war, it was young people. It was always the young people who suffered. It was the young people in the war.
We have to leave. We've got to leave it there, both of you. Thank you so much today for talking to us. And later on today, there will be a statement by the Prime Minister, followed by a press conference.